Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach. And I'm going to do, over the next several videos, we're going to do a series on non-surgical spinal decompression. And I know that our team here at The Fix is very well known for our functional therapy approach to healing. We work with thyroid patients, diabetic patients, chronic fatigue, depression, all kinds of chronic illnesses, and we help those patients neurologically, metabolically, have a lot of success with that. But one of my passions here in this practice is helping patients avoid back surgery. And one of the reasons that's so important to me is because I have a very personal story. When I was young, when I was 18 years old, I was playing football in college with some friends, and I bent down to catch a pass, and my back went out. I got my first chiropractic adjustment right after that, and kind of fell in love with chiropractic at that point. Loved getting adjusted. Got adjusted a few times over the next 3 or 4 years. When I was 24 years old, I was sitting on a couch and I was playing tug of war with a Chihuahua. And this Chihuahua, it's a little bitty dog, wrestling with him, and I kind of tweaked in the wrong direction, and I felt a sudden twinge of pain in my back and I couldn't stand up. Over a period of about 8 months, I had several chiropractic adjustments, I did a lot of different treatments. I ended up having back surgery. My L5-S1, I had completely blown my disc back in my L5-S1. So I had back surgery. I ended up, because I was already under chiropractic treatment, I had an excellent doctor at the time, took great care of me. I rehabbed myself. I had a degree in sports science, so I rehabbed myself, and I've done well with that, with a lot of maintenance and a lot of effort over the years. But I saw somebody else very close to me go down a different path. So we're going to backtrack a little bit. And when I was 19, there was a very close friend of mine who was 18 years old who started having back pain, and she ended up, it was unresolvable. So she ended up having back surgery. Came out of that back surgery, refused to get adjusted, refused to do the therapies that were required to try to rehab herself, just kind of continued to spiral downhill. Had another back surgery another couple of years after that. This time they had to do a fusion. A couple of years after that, had a third back surgery. By the time this friend of mine was 27 years old, she had, I think it was 4 back surgeries, was scheduled for her 5th back surgery, and ended up passing away. She had become dependent on pain medication, just a lot of different factors of that, but she went on a downward spiral, and I watched this begin from that first back surgery. Now, I'm not anti-back surgery. Sometimes it's necessary. I'm a chiropractor, we try to keep people out of that, but sometimes we can't help patients, so we will refer them for that. So I want to make that very clear. Sometimes surgery is the only option, but you should do everything possible to avoid that if you can. So we're very, very passionate about that here in our practice, about helping patients avoid back surgery. And one of our best weapons for that is non-surgical spinal decompression. We didn't have this back when I had my back surgery, or I think that I may have been able to avoid that. We've helped hundreds of patients coming through our office avoid back surgery by using non-surgical spinal decompression. These patients were dealing with chronic issues such as sciatica, degenerative joint disease, stenosis. They had central canal stenosis. They had a lot of different chronic issues that we were able to keep them out of surgery with this technology. So over this next several videos, I'm going to explain to you what it is, how it works, when to use it, why to use it, and give you a good understanding about what's going on with that. But I wanted you to understand why it was important to me that patients that are on the brink of surgery look at this as a very, very viable option before they proceed with surgery.